You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people with knee problems. According to my first guest, he says that there are many people that are suffering that don't have to be. We're talking about stem cells today and all the new regenerative techniques that orthopedic surgeons are using across the country. He is one of the leaders or the go-to person when you have a knee problem in Nashville. With us, we have Dr. Kellum. Dr. Kellum, welcome to the program.
Thanks for having me, Randy.
Good. Now, now you're an orthopedic surgeon.
Correct.
And you're involved in this new, I'm calling it new, but regenerative medicine. What is regenerative medicine?
So regenerative medicine it's definitely a new field. It's been around since, as far as 2005. But it's taking your own body's capability to heal itself. The problem with joints, ligaments, tendons, nerves, other musculoskeletal tissues is there's not a ready blood supply to it, and so when those things kind of wear out over time, they can't heal like they should. And so we're essentially taking those things and putting them in the places where they need help.
So with regenerative medicine, what are the different options? Like, what are you injecting into the knees? What are you injecting into the shoulders, et cetera?
Yeah, so the things that we inject are things from the patient. They're going to be stem cells, they're going to be platelet-rich plasma, and they're going to be things, be prolotherapy. Stem cells are things that's going to come from you. They're kind of like the bosses. They're the big cells that come about when there's an injury. We normally can get them from bone marrow. We can get them from adipose. Also, there's platelet-rich plasma, or PRP, that comes from your blood. There's two different things in blood. There's solids and there's liquids. And one of the solids is platelets. We normally know them for clotting.
So taking their own blood, spinning it.
Correct.
Like getting the growth factors.
It has growth factors in there. So we get those, we concentrate it, and then we put those back into the area of injury.
Like if it's a knee, you just inject right into the knee.
Yeah, we inject into the knee joint, or sometimes we'll inject into the meniscus. Sometimes we'll inject into the ligaments that are around there, just depending on what we're trying to help be better, feel better, and heal. And then the other thing we use a lot is prolotherapy, which is essentially a sugar water.
Okay.
Been around since the 60s or so. It usually helps to stabilize joints, ligaments, tendons, nerves. It kind of acts as an irritant in attracting healing cells.
Okay, and that, I told you, I interviewed a guy on prolotherapy 20 years ago. Mm-hmm. Does it work?
It does. It does, yeah.
Okay, so let's begin with your typical patient that you see that's coming in for stem cells or one of these, I guess, alternative to surgery treatments.
Right. So we really don't have a typical patient. I mean, we kind of have folks that are, the athlete, right, from anywhere from high school to professional, that'll come and see us for different injuries, trying to get back into the game, trying to improve what's going on, heal their injury. So the second type of person that comes to see us is just, they're the business person, they're the active person. They're, they go to work every day and they're trying to, they're in pain, but they want to feel better. They're having the shoulder issues or the elbow issues with typing, or, just walking up and down the stairs for their job.
Like their knees hurt.
Their knees are going to hurt, or maybe it's their hip or their back. These are the folks that come see us that want to get some help, where there may not be a surgery for it, but these are things that can definitely help them get back to their feeling well every day. So
can you get fast results? I mean, do you have stories of people that bad knees and they're going, wow, one injection and that's it?
Yeah. So talking to speaking of our professional athletes, one of our guys there in Nashville, plays for the Titans, had really muscular strain to his thigh, and actually saw another guy in Pennsylvania who said, we got to do surgery on this. He didn't want to do that. He came to see us. We injected him with stem cells and platelet-rich plasma, back out on the field within a week and a half, and so doing well. Hadn't had issues since.
Okay, good. So tell us about your background training.
Mm-hmm. Yeah, so
because you're a traditionally trained orthopedic surgeon.
Correct.
Then you got involved in this regenerative stuff.
Right.
So tell me about that little bit of that journey.
Yeah. So orthopedic surgeon. Love to work with my hands. Loving getting people back into doing the things of life. Did the typical orthopedic surgery residency. Went into a sports fellowship, and that's where once again I learned about these things, and really took off for me once I got into practice. I had a guy that was a runner, and we know that runners are crazy people and they'll do anything to run. And he had really bad Achilles tendonitis. And so when he came to me, he had seen 2 or 3 other orthopedic surgeons. He's like, so, is there any way that you can help me? He had done physical therapy. He had been in a boot, still, having pain when trying to run with his Achilles. And so literally he's walking out the door.
Okay.
And I said to him, well, we can try this thing called called PRP. I learned that in my training. That's what we treated those athletes with.
That's the platelet-rich plasma.
Yeah, platelet-rich plasma. And so, he said, well, let's do it. He did it. 3 months back to running marathons. And so that's where things took off for me, as far as knowing that these things were very helpful, as far as getting people back to, getting them out of pain, getting back to their activities that they love, whether it's running or playing with their grandkids or, back on the court or the field. And so as I experienced that with my patients, that's when those things started to grow.
What about the couch potato? Some of it's just, they're just wear and tear. Yeah. Maybe they used to be an athlete, 20, 30 years ago, and now they're just kind of slowing down, but they have bad knees or a bad shoulder.
Right, yeah.
Does this work for them?
No.
Or do you have to be an active person?
No, it definitely works for them. So just, people that are in pain who want to be out of pain and want to be more active than what they are, this definitely can help them get back to doing those things.
You say osteoarthritis.
Osteoarthritis.
This works great for those people with that when they have knee osteoarthritis.
Correct. Yeah. Knee problems are our favorite thing to take care of in the office because they do extremely well. And when I say well, 9 out of 10 people that walk into our office that have arthritis of their knee, after we treat them, they're going to be doing really well and doing well for a long time. We love treating
So you use their own stem cells, just so I'm correct. Okay, so from their hip, you extract the stem cells.
Right.
And it's all in one day, and then you inject it back into the area, like their knee or their shoulder.
Right. Well, yeah, it's a little bit of a process. So we normally see people over about a week's time frame, and they get 3 different types of injections from us. First, they get the prolotherapy, which is essentially the sugar water, helps attract healing cells and gets the joint ready. The next is going to be a stem cell injection where we extract the bone marrow from them. And most people go, gosh, I think that, that probably hurts quite a bit. Very, very doable. What you've heard is stories in the past when people have done those for, cancer patients or things like that. Those guys are probably very rough in their technique. We do it where it's about a 1 or a 2 on the pain scale. People always, they're like, man, that's going to hurt. After they do it, they go, that wasn't as bad, and it's always that way. And so once we extract those cells, we then process it in our lab. We have a lab in our office.
This is all on the same day.
All in the same day. So we process those things, concentrate it, get what we want for them, very precise. Then we inject it back into the areas where it's their joint or their ligaments or their tendons, their muscle around nerves in their spine. And we use ultrasound, so it's image guided, which is very important. And then they come back a few days later. We take their blood, get the platelet-rich plasma, and then we inject that back into those areas.
Now, you're one of the leaders, if not the leader, in Nashville when it comes to stem cells as an orthopedic surgeon.
Correct.
Not a lot of guys doing this.
Correct.
Is that right?
Yeah.
Why aren't they doing it? Is it because insurance really doesn't cover it? Like Medicare, Medicaid, PPO insurance, what they look at this is like prevention?
So that's definitely part of it, right?
It's not a lot of money. I mean, I know the prices to get this done.
Mm-hmm. Definitely, that's part of it as far as it's not covered by insurance. The other part is sometimes when you have, when you're a hammer, everything's a nail.
Okay.
Right. And so my colleagues, and I can talk about them because I'm one of them, right? We were trained to do surgery, and that's what we do. And over time for me, I have realized that surgery isn't always the best option, right? You have someone that comes into you and they've got a meniscal tear. And we've had 4 large studies, like 20,000 plus patients, where we said, okay, they got a meniscal tear. We're going to go in there, we're going to trim that out, right? And it doesn't work. What happens is you go in there and you trim that meniscus out. Now the stresses across that knee are different. They're going to develop arthritis faster, and then you're going to guarantee that they need a total knee. Whereas if you use things like stem cells and platelet-rich plasma, you can get that person out of pain. You leave that meniscus there because even though it may be damaged.
Does it rebuild some of the tissues?
It can. It definitely can. So stem cells work in a couple of ways, right? So the first way that it works is that it can help that tissue that is there be bigger, stronger, and faster.
Okay.
But that's not the most important way. The most important way is that you can kind of think about this. You've got this inflammation in your joint, and what's causing that is kind of like this alphabet soup that's in there. So you have the alphabet soup that's in there. So let's say it's A, B, C, and D. And so when those things are around, those particular letters will cause pain. Stem cells go in there, gets rid of those letters. And when those letters are gone, your pain and inflammation is gone. And when your pain and inflammation is gone, then your function is better. You still have the damaged meniscus, you still have arthritis, but your pain is significantly decreased, and therefore your function is better. A lot of people come in And you can see them. You got one person that has the same X-ray. There are two people, same X-ray, but one doesn't hurt and one does. It used to baffle me. And I'd ask my attendings, why does this person hurt and this one doesn't? But now I know that it's all about the environment of that joint, right? And so stem cells and platelet-rich plasma and prolotherapy help make that environment better. Also makes the tissue better as
So
well.
have there been studies like total knee replacement done in the hands of a great surgeon and somebody that just injected their knee with similar problems?
Yeah.
And what were the outcomes like?
Yeah, so there was a study done not too long ago by a French surgeon that's been doing stem cells and PRP in all over the body, especially knees, since the 90s.
Okay.
He did a study that was had follow-up for 12 years. And so if you know anything about research, 12 years is a long time. Okay. But it was very interesting because he did, he was the surgeon that took care of this patient. On one side, he did a total knee. On the other side, he did stem cell.
Oh, one patient, okay.
In one patient. 12 years down the road, the people, the far majority of the patients loved their knee that they had stem cells on versus the knee that was operated on. And so that's a very powerful study that shows us that these things can work and can work for a long time.
What's the estimate of total knee replacements?
If you're
annually, across the country,
as far as like how many that you do, there's probably
more than 100,000.
Oh yeah, 600.
600,000.
Yeah.
Of those 600,000, I'll put you on the spot. If you think if you caught them early and started with stem cells, you could have eliminated those surgeries?
Not only if you caught them early, but even late, I would say that you could probably forego 70% of those.
So this is kind of a movement across the country, right?
It is.
Where stem cells, for those that want to pay out of pocket,
right,
can avoid surgery and get out of pain and back. But what about function? So like if it's a tennis player,
yeah,
lots of sudden stops, moving, side moves. You're back.
Yeah, I'm always amazed at just how it makes things better. But take someone with tennis issues, right? Tennis elbow is a big thing. Taking that swing, those folks can get back to doing what they're doing without any pain. And in fact, one of the things that we have, this is a D1 softball player, and she came to us. She's 19 years old, had been dealing with lateral epicondylitis for
what does that mean?
So you have a tendon that connects into your elbow, and
sometimes like tennis elbow.
Exactly, tennis elbow. And so it'll get inflamed. There's some partial tears in there. She came to see us. She'd done all the other things. She'd had like dry needling. She'd been seen by her chiropractor. She'd been seen by a physical therapist, taking the anti-inflammatories, but just not getting better. And to her dad, who was her coach, thought, well, gosh, is she going to have surgery? And is she going to be able to make it to that next level? She'd had D1 schools looking at her, offering her scholarships. Okay. And so she came to see us, and we looked at her. We thought that she was a good candidate. Hey, we're going.
She took her own stem cells.
Took her own stem cells. From
her hip.
So from her bone marrow.
Okay.
Processed that in our lab. Used image guidance to inject that back in there. And like I said, she's now a freshman and doing well.
Back 100%.
Back 100%, doing great. So this gentleman came to see us. He is in his 70s. He's a big-time elk hunter, and he, would take a yearly trip up to Montana to hunt. He got to the point that he had some really bad, severe knee pain that prevented him from doing that. He would hike upwards of 15 miles in the woods while elk hunting. And so, he just couldn't do that thing that he had been doing for so long and loved. And so we went to go see an orthopedic surgeon, told that he needed to have a total knee replacement done. He had been through the physical therapy. He'd had cortisone injections, anti-inflammatories, and those things have some pretty bad side effects as far as cortisone or steroid. When you put them in a knee joint, actually destroy the knee. You may feel better for a little while. Yeah, may feel better for a little while, but it actually destroys the knee. So I really get away from doing that. In fact, heard a story from Dr. Morey, who was the chief at Mayo Clinic several years ago. He was the orthopedic surgeon to the first President Bush. And he tells a story that he had a problem with using steroids, but steroids were discovered at Mayo Clinic, early 1950s. They won a Nobel Peace Prize for it.
Is that right?
And he had a hard time saying, man, I just don't want to use that anymore. But that's the truth. It's harmful for joints. There's very little instances when you should use that. So this patient had all those things discussed. And but he just wasn't ready for metal yet. He wasn't ready for that total knee. So you searched for his options, found us.
Found you online.
Found us online. Came to see us. Felt like once again that he was a good candidate. Took his own stem cells, put that back in his knee and around his knee. And as you can see from
so
the
he's
picture,
back hiking.
Back doing that 11 plus miles in the woods and hunting.
So how old can you be to get this done?
Yes.
To get stem cells.
Yeah, so the oldest that we've ever treated in their 80s. We've seen patients in their 90s. Haven't treated them just yet. We'll kind of see.
But with 80s, aren't there? I mean, don't stem cells age? I mean, isn't it true? Stem cells, if you're 20 years old, are different than stem cells when you're 80 years old. Do they still work? And is it still worth going through the process of extracting from their marrow stem cells and then injecting them?
Yeah, there's no doubt that they definitely still work. Okay. Even into either 80s. A stem cell is a stem cell, and it'll always be a stem cell until until we're gone. And are they different from 20 to 80? Yes, but they're still stem cells, and they still definitely work.
They still work.
Yeah.
So what was the outcome on this 80-plus-year-old?
Yeah. So wanted to be very active person. Treated them with stem cells and platelet plasma, able to get back to walking and just spending time with their kids, their grandkids. But the biggest thing is being out of pain on a daily basis.
Have you treated any of your family members with this?
I have.
So anybody has any pain, you're just giving them stem cells?
Yep, stem cells and PRP, prolotherapy as well.
Prolotherapy. Mm-hmm. Okay, good. Now you brought some photos.
Yeah.
Which I didn't expect these photos, by the way. It's good. You're happy patient stories.
Yes, yeah. In this particular patient that we're talking about, 74-year-old woman who's very active. She loves to be in the woods. She loves to garden, and was having severe foot pain for 3+ years. Done all the typical things, right? Seen physical therapy, all the rubs, cortisone injections, but just not getting better. Came to see us, and we evaluated her, looked at the imaging. She was dealing with arthritis within her foot. And so with precise guidance of those stem cells, she was able to get back to hiking.
She's climbing fences. She doesn't even go through gates anymore.
She
just climbs over the fence.
Doesn't. 74 years old. I want to be that way.
So for arthritis, like osteoarthritis, this is great for if you have it in your knee or your foot.
Right.
And by the way, defining that, is that like kind of a wear and tear?
Wear and tear,
That's not autoimmune, right?
Not autoimmune. So that would be rheumatoid arthritis.
Okay.
This is a wear and tear. So we've been active, we've gotten older, right?
What about bone on bone? Like you hear stories of they're bone on bone. It's too late for that, right?
So it's very interesting with bone on bone. I have found that it definitely can help. The biggest thing around the knee is if they have bone on bone and the alignment is off, then maybe it doesn't work as well. But if they have bone on bone and they have good alignment.
Now, I know legally we have to say, results aren't typical and things like that, but it sounds like for knee, results are typical.
Knees are...
like 9 out of 10, like 90% possible success rate,
we'll get some
big improvement.
Yeah, we'll get some significant relief. My office manager tells me often, we should just do knees all the time.
All day long.
All day long. And that we're perfectly happy with that.
Well, as a doctor, you must like doing knees if it's getting the best results, right?
Correct.
Because you don't want to hear the patient saying, I did it and nothing. Right.
And you definitely understand that comes about, but we love when they get success. And so knees respond very well, shoulders do.
Now you're involved with this company, this Regenerative, that is the most, I guess, has done the most research, the most published articles on stem cell therapy. They're the leaders in stem cell research.
Doing procedures. Those guys have been doing it since 2005. When I was looking for in education, right? Because I need to educate myself. I had learned some of these things in fellowship, but then I'm out in practice. And as I was doing more of these, I want to know, how can I help my patients the best way? And I kept coming to Regenerative because they, once again, had the research, they had the knowledge, the whys, the hows, the how much, the follow-up, and that's key. I mean, every patient that Regenerative through all of their affiliates, which I'm one of those, we track them. We look at how they're doing, how long they've been out there. And so, I knew so much just from the get-go as far as seeing my own patients to say, this is how long it's going to take for you to get better. This is how long it's going to last. This is how much, of the particular concentrator that I need to use, or maybe I need to use stem cells here versus just PRP. And so Regenerative definitely the leaders of that. And
so it takes judgment on your part. Yeah. You're evaluating the situation, then you have to, like the protocol or this regenerative cocktail, if you will, of putting it all together. You say it's over like 2 or 3 appointments oftentimes?
Right, yeah. So, initially see them, evaluate them, try to understand exactly what's going on with them, and then, come up with a precise plan for them. Okay. And so it's just not, we just don't take anything willy-nilly off the shelf and everybody's the same and we're going to do it this way. It's very, very calculated on
knowing
our part.
You're going to come on this program, right? Like when you're flying over here, okay, to our studio, what do you think, like your main message is what? What do you want people to know about stem cells and treating knees or shoulders?
Yeah, and so my main message, if you are looking to avoid surgery and to feel better, to get back to your activities that you love, whether that's hiking or playing sports or fishing or hanging with your grandkids or your children, or getting back on doing to the sport of life. That there's another option that is a really, really good option that's going to help you avoid things that are going to be dangerous to you, avoid surgery. Because once you have surgery, there's no going back. We joke and say, we can either make you better or we can make you worse in surgery, but we're always going to make you different. And so with these things that we do, very little downside.
So your own stem cells, using from the hip.
From the hip.
You extract that out.
Yeah.
Not so painful.
No, one or 2 on the pain scale. And like I said, we've, people usually think that that's the thing that hurts the most, and it doesn't. You're gonna have more pain after the injection than you will from us doing that. Our professional athletes don't like to take any of the pain medicine that we offer to just kind of help ease the pain. Some of the anxiety medications, they don't like taking that. So even with them, all we have is numbing up that area. Right, okay. And they do very well, 1 or 2 on the pain scale. So this patient came to see us. He was a 39-year-old guy that was involved in martial arts, so doing things like the UFC fighting, MMA. Came to us, had a partial tear to his rotator cuff. He went to go see orthopedic surgeon who said, okay, we're going to do physical therapy. You can do a steroid injection. We're going to take some anti-inflammatories, and he did all those things. Didn't work. Went back to him, said, okay, well, we're going to go in and operate. Didn't want to do that. Found us. Okay. Came to see us. We use, once again, a precise injection of stem cells from him, his platelet-rich plasma, that sugar water, the prolotherapy. In this picture that we see, he's now 6 months out.
And he sends you this photo.
Sends me this photo. He's back to grappling in full swing. A little earlier than what we want him to, but he was feeling so good that.
Do they ever call you like 6 months later and say, Doc, you're not going to believe this? I mean, I'm back.
Yeah.
It worked. It actually worked.
So, we develop a very good relationship with our
Did they get mad? Sorry to interrupt, but did they go, I can't believe I was told I needed surgery, and you were able to do it with just injections?
Yeah, that
must bug them.
That's always a statement, but truly at the end they're very relieved that they didn't have to do that.
Good.
And so they're like, hey, I'm gonna tell all my friends about this, and if I need anything else, we're gonna come back and do this. Is it a big word of mouth thing? It is.
Because weekend warriors, people that this holistic crowd, I mean, they hang out with other people that are just like them.
Yeah.
Sometimes.
No, they definitely, it's one of those things. They want to share what's helped them.
Okay.
And so it's a huge word.
Time for one more photo.
So this patient is a lady that lived north of us in Kentucky. Came to see us. Been having neck pain for several years. She had, once again, dry needling, steroid injections into her neck, physical therapy, not getting better, and just suffered with those things. And so she came to see us. We evaluated her, found that she was a good candidate. In the spine, we mostly use PRP. PRP. We have found through our research that works the best.
Okay.
And so injected her with those things. And, her biggest thing was she liked to go hiking and have fun. But her biggest thing was just going to work and not being in pain while she was sitting at her desk. And she's
So you do the therapy, and then she sends you these photos. Mm-hmm. Do you tell them to send them the photos, or they're kind of compelled to send you these photos?
No, they're compelled a lot of the times, just because they're doing so well, and we enjoy that.
Who's the workout guy over there?
So this guy is one of our military guys, and we're always very thankful to see them. He's still involved in that, still active duty. He now ROTC and teaches our children the things that he's done over time. But he was having severe hip pain, and young, 54, told him that, hey, you're probably going to need a total hip. Didn't want to do that. He went through all the standard things. We're going to take the anti-inflammatories. What about a steroid injection? Physical therapy, not getting better. Found us, came to see us, treated him with stem cells and PRP, and he's doing great.
Like how great?
Like back to working out, as you can see.
So he just says, like, this is it.
Yeah.
Avoided surgery altogether. Mm-hmm. Didn't change.
Yeah. So with him, he's back. He's doing well. He's telling his friends like how well he's doing. And once again, we're very thankful that they share those stories with us.
Okay, good. Final message. Somebody watching this, they're skeptical, very skeptical. Mm-hmm. Obviously, they've heard about stem cells. They've heard about platelet-rich plasma, prolotherapy, and for whatever reason, they're in pain, or they have a loved one in pain. What do you say to them?
Yeah, so, it doesn't hurt to come in for evaluation. Let us take a look at what's happening, right? What's going on, evaluate that, come up with a precise plan, and then see if we can help you. And I think the far majority of the time, we can.
How often do you say, I don't think so?
It depends on the joint, right? Hips don't do as well, but there's not a lot of times that I say, hey, we can't. We usually can make things better. We usually can get people back in the game of life.
I have to bring this up. So there's a lot of these physician's assistants, nurse practitioners that are doing injections. At least that's the way it is here in San Diego. Does it cost more to go to an orthopedic surgeon?
No, not at all. And I think that
you have a bias. You think that if you're going to get something injected, might as well go.
Well, I've been trained. I do surgery on these things. I look at this stuff every day. I've seen them non-operatively. I've seen them operatively. I know the difference, the diagnosis. This is what I've been trained to do, and so I definitely have a bias towards how it's done, and definitely also not only an orthopedic surgeon, but as a regenerative medicine specialist. So when you combine those two, I think you get a pretty good deal.
And you've been involved in stem cells for how long? Like, how long have you been interested?
So that's been 2008, 2013.
2013.
Yeah.
Are you excited about the next 10 years?
Oh yeah,
it's what you're going to be able to do.
It's only going to get better. It's fun. I love how we do it. It's just a good time. It really helps. It's always been my calling, right? As far as to get people, to help heal their injuries. And I used to do it with just surgery alone, and now I do it with these things. It's a lot of fun. So the
pro athletes are all over this. They're doing this. This is all over the NBA.
NFL, MLB,
and even the couch potatoes now can take advantage of this.
Yep. Everyday regular people.
Okay, good. I want to thank you for coming on the show. Good stuff.
No, thanks for having me.
All right, thanks. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.